Question 1. A patient with ANC 200 per cube millimeter is awaiting transfer. The transport team arrives without PPE. What is the nurse's most critical action? A. Delay transfer until PPE is obtained. B. Allow transfer but provide a surgical mask to the patient. C. Proceed if transport is under 15 minutes. D. Have nurse accompany the patient and monitor closely. Answer. A. Delay transfer until PPE is obtained. Rationale. Patient must not leave isolation unless infection control standards are met. Safety overrides timeliness. Allowing transfer without PPE risks systemic exposure. Question 2. 2 private rooms are available. One is negative pressure, the other is positive pressure. Which patient should be prioritized for the positive pressure room? A. Patient with disseminated shingles. B. Patient with influenza and hypoxemia. C. Patient with ANC 50 per cube millimeter after chemotherapy. D. Patient with tuberculosis under evaluation. Answer C. Patient with ANC 50 per cube millimeter after chemotherapy. Rationale. Positive pressure protects severely neutropenic patients from pathogens. Negative pressure is required for airborne patients. Question 3. A patient suspected of TB needs emergency surgery. Which infection control action is most critical? A. Ensure N95 respirators are used in OR. B. Place patient under droplet precautions only. C. Postpone surgery until sputum results are back. D. Provide the patient with oral antibiotics before OR. Answer. A. Ensure N95 respirators are used in OR. Rationale. Airborne precautions must be maintained in OR. Delaying surgery may be unsafe if it's an emergency. Question 4. A patient with confirmed C. difficile infection asks why alcohol sanitizer isn't enough. The most critical teaching point is A. Spores resist alcohol and require soap and water. B. Your strain is resistant to all sanitizers. C. Alcohol sanitizers only reduce bacteria, not viruses. D. C. Difficile hides inside the bloodstream. Answer. A. Spores resist alcohol and require soap and water. Rationale. Critical patient teaching includes spore resilience. Patients must understand why standard methods are insufficient. Question 5. A nurse removing PPE after caring for a patient with Ebola forgets to remove face shield before gown. What is the most immediate action? A. Continue removal and wash hands after. B. Stop, reapply PPE, and restart doffing with observer. C. Ask another nurse to remove shield for them. D. Double glove and finish doffing quickly. Answer. B. Stop, reapply PPE, and restart doffing with observer. Rationale. Sequence breaches require restarting under supervision to prevent contamination. Question 6. A patient with meningococcal meningitis is in droplet isolation. During a code, several providers rush in without masks. What is the nurse's highest priority? A. Continue CPR until masks are available. B. Stop providers and require masks before entering. C. Assign one provider to stay masked and lead code. D. Provide the patient with a surgical mask. Answer. B. Stop providers and require masks before entering. Rationale. Staff safety cannot be compromised. Infection control remains priority even in emergencies. Question 7. A patient post-transplant refuses to avoid raw foods despite education. Which action by the nurse is most critical? A. Reinforce risks of infection and document refusal. B. Contact provider about need for additional teaching. C. Notify infection control of patient noncompliance. D. Involve family to support food safety teaching. Answer. A. Reinforce risks of infection and document refusal. Rationale. Patient autonomy exists, but nurse must ensure risks are explained and refusal documented legally. Question 8. A nurse finds another nurse using the same gown for 2 patients in isolation. Which is the priority action? A. Immediately remove the contaminated gown. B. Report to charge nurse first. C. Document unsafe practice and move on. D. Tell infection control at end of shift. Answer. A. Immediately remove the contaminated gown. Rationale: direct, real-time intervention is required to stop cross-contamination. Reporting or documentation follows. Question 9. A central line dressing change is required, but sterile gloves are unavailable. What is the safest action? A. Use clean gloves with sterile technique as best as possible. B. Postpone dressing change until sterile gloves arrive. C. Ask another unit to borrow sterile gloves. D. Perform with double clean gloves. Answer B. Postpone dressing change until sterile gloves arrive. Rationale: central line care must be sterile. Attempting with clean gloves risks bloodstream infection. Question 10. A patient with suspected SARS is refusing to wear a mask during transfer. What is the nurse's highest priority? A. Delay transfer until the patient agrees. B. Proceed with transfer and ensure staff wear N95s. C. Cover patient with a clean sheet and transfer urgently. D. Sedate the patient if refusing mask. Answer B. Proceed with transfer and ensure staff wear N95s. Rationale: staff protection with N95 is critical. Transfer cannot be delayed if urgent. Patient compliance is secondary. Question 11. A patient with ANC 400 per cubic millimeter insists on eating strawberries from home. Which response ensures safe autonomy? A. I'll wash them thoroughly for you. B. You can eat them if you sign a waiver. C. Raw strawberries increase your infection risk significantly. D. Frozen strawberries are a safe alternative. Answer C. Raw strawberries increase your infection risk significantly. Rationale: patients have autonomy, but informed refusal requires clear risk explanation. Question 12. A patient with suspected TB is coughing violently in the ER waiting area. What is the nurse's first action? A. Provide N95 to the patient. B. Escort patient to airborne isolation. C. Give patient a surgical mask. D. Alert infection control and security. Answer C. Give patient a surgical mask. Rationale: source control is immediate priority before moving to isolation. Question 13. AC. Difficile patient is on contact precautions. Which action by UAP requires immediate correction? A. Using soap and water after patient care. B. Wearing gloves while providing bed bath. C. Carrying patient's chart into the room. D. Using dedicated stethoscope in room. Answer C. Carrying patient's chart into the room. Rationale: supplies should not enter contaminated rooms unless necessary. Chart contamination spreads spores. Question 14. A patient with influenza is demanding discharge after 24 hours on antivirals. Which is the nurse's most critical response? A. Droplet precautions must continue for 7 days. B. You can only leave if your fever is gone. C. You must stay until your cough resolves. D. We need infection control to clear you. Answer A. Droplet precautions must continue for 7 days. Rationale: infection risk remains. Discharge criteria are not just medication-based. Question 15. During suctioning of a ventilated patient, a nurse forgets to wear eye protection. What is the safest immediate response? A. Stop suctioning and reapply PP. B. Continue and wash face immediately after. C. Ask another nurse to suction instead. D. Complete procedure quickly to avoid hypoxia. Answer A. Stop suctioning and reapply PP. Rationale: continuing exposes nurse to splash pathogens. Patient stability matters, but safety cannot be bypassed. Question 16. A nurse brings home PP for emergencies. What is the most urgent response? A. Educate nurse about proper PP use. B. Report immediately to infection control. C. Ask nurse to return PPE to unit. D. Document and monitor for repeat behavior. Answer B. Report immediately to infection control. Rationale: taking PPE home endangers community safety and violates infection protocols. Question 17. A patient with MRSA pneumonia refuses to wear a mask when coughing. What should the nurse do first? A. Reinforce education about infection spread. B. Document refusal and alert provider. C. Place a surgical mask on patient despite refusal. D. Restrict visitors until cough improves. Answer: A. Reinforce education about infection spread. Rationale: patient understanding is key. Forced masking is not ethical. Reinforcement ensures informed compliance. Question 18. A nurse caring for a C. difficile patient prepares to leave room, but uses sanitizer instead of soap and water. What is the safest nurse action now? A. Re-enter and wash hands with soap and water. B. Double glove until next hand wash. C. Continue duties and wash later. D. Apply sanitizer again for added safety. Answer: A. Re-enter and wash hands with soap and water. Rationale: spores remain unless washed off. Redoing hand hygiene is mandatory. Question 19. A patient on steroids with oral thrush refuses oral care. What is the most urgent intervention? A. Respect refusal and document. B. Explain oral hygiene prevents systemic infection. C. Provide antifungal medication immediately. D. Place patient in protective isolation. Answer: B. Explain oral hygiene prevents systemic infection. Rationale: patient teaching emphasizes risk of fungal sepsis. Autonomy requires informed refusal. Question 20. A nurse is floated to care for protective isolation patients. Which assignment is unsafe? A. Neutropenic patient post-bone marrow transplant. B. Post-appendectomy patient on antibiotics. C. Influenza patient in Droplet Precautions. D. Stable patient with healed surgical wound. Answer: C. Influenza patient in Droplet Precautions. Rationale: cross-contamination from infectious to immunocompromised patients is unsafe. Question 21. A patient with suspected TB refuses to stay in isolation. What is the nurse's highest priority? A. Notify infection control and provider immediately. B. Respect autonomy and allow patient to leave. C. Transfer patient to a shared medical ward. D. Provide antibiotics and discharge. Answer: A. Notify infection control and provider immediately. Rationale: public safety outweighs autonomy. TB isolation is legally enforceable. Question 22. A patient on neutropenic precautions has visitors bringing fresh flowers. What is the nurse's safest action? A. Allow if flowers are kept at bedside. B. Place flowers outside the room. C. Explain flowers increase fungal exposure risk. D. Let visitors decide after explanation. Answer: C. Explain flowers increase fungal exposure risk. Rationale: patient education prevents high-risk fungal contamination. Question 23. Which task can the nurse safely delegate to UAP for a patient in droplet isolation? A. Transporting patient to X-ray with mask. B. Assessing breath sounds before ambulation. C. Teaching patient how to cough safely. D. Deciding when to discontinue precautions. Answer: A. Transporting patient to X-ray with mask. Rationale: UAP can transport under supervision. Assessment and teaching are RN roles. Question 24. A nurse is entering a patient's room with Ebola. Which PPE error requires the fastest correction? A. No double gloving. B. No face shield. C. No shoe covers. D. No gown. Answer: D. No gown. Rationale: a gown is critical for full body coverage. Absence risks direct exposure. Question 25. Which of these patients requires protective isolation? A. Patient with WBC 12,000 per cube millimeter. B. Patient with ANC 200 per cube millimeter. C. Patient with hemoglobin 9 gram per deciliter. D. Patient with platelets 90,000 per cube millimeter. Answer: B. Patient with ANC 200 per cube millimeter. Rationale: severe neutropenia, less than 500, requires protective isolation. Question 26. A patient on contact precautions has lab specimens ready for transport. Which step is most critical? A. Label specimen inside patient's room. B. Double bag specimen before transport. C. Hand specimen directly to lab staff. D. Spray specimen container with sanitizer. Answer: B. Double bag specimen before transport. Rationale. Double bagging prevents contamination and maintains chain of safety. Question 27. Which finding in a patient with systemic infection requires immediate provider notification? A. Fever 38.2 degrees Celsius. B. Heart rate 110 BPM. C. MAP 58 millimeters of mercury. D. WBC 12500 per cube millimeter. Answer. C. MAP 58 millimeters of mercury. Rationale. Hypotension signals sepsis progression requiring urgent intervention. Question 28. Which precaution is required for a patient with varicella, chickenpox? A. Droplet only. B. Contact only. C. Airborne in contact. D. Standard only. Answer. C. Airborne in contact. Rationale. Varicella spreads through both airborne and contact routes. Question 29. A nurse is assisting during CPR for a patient with influenza. Which PPE is mandatory? A. Surgical mask only. B. N95 mask, gown, gloves, eye protection. C. Gloves only. D. Face shield only. Answer. B. N95 mask, gown, gloves, eye protection. Rationale. CPR generates aerosols, requiring airborne level protection. Question 30. Which action shows a break in aseptic technique during central line care? A. Using sterile gloves. B. Wearing mask during dressing change. C. Touching sterile field with clean glove. D. Cleaning site with chlorhexidine. Answer. C. Touching sterile field with clean glove. Rationale. Sterility breach risks bloodstream infection. Question 31. Which patient situation requires airborne precautions? A. Pertussis. B. TB with coughing. C. MRSA wound infection. D. RSV bronchiolitis. Answer. B. TB with coughing. Rationale. Only TB requires airborne precautions in this list. Question 32. Which visitor action violates infection control for a neutropenic patient? A. Wearing mask and hand washing. B. Sitting 3 feet away from patient. C. Bringing homemade food. D. Speaking softly with patient. Answer. C. Bringing homemade food. Rationale. Homemade food increases contamination risk. Question 33. Which is the priority assessment for a patient with sepsis under treatment? A. Blood culture result timing. B. Mean arterial pressure trend. C. Antibiotic administration record. D. Temperature every 4 hours. Answer. B. Mean arterial pressure trend. Rationale. Hypotension signals septic shock and requires rapid intervention. Question 34. A nurse is preparing to discharge a patient with MRSA. Which teaching is most critical? A. Wash hands after touching wound dressings. B. Wear gloves when sleeping. C. Dispose of laundry in sealed bags. D. Avoid showering daily. Answer. A. Wash hands after touching wound dressings. Rationale. Hand hygiene is the most effective way to prevent spread at home. Question 35. Which staff assignment places a neutropenic patient at greatest risk? A. Nurse with mild cold symptoms. B. Nurse with hand dermatitis using gloves. C. Nurse floated from pediatric unit. D. Nurse caring for 2 surgical patients. Answer. A. Nurse with mild cold symptoms. Rationale. Viral exposure is most dangerous to immunocompromised patients. Question 36. Which PPE is required when irrigating a wound with purulent drainage? A. Gloves only. B. Gloves and gown only. C. Gloves, gown, mask, eye shield. D. Standard precautions only. Answer. C. Gloves, gown, mask, eye shield. Rationale. Splash risk requires full droplet and contact protection. Question 37. A patient with suspected meningitis is febrile and confused. What is the nurse's priority infection control action? A. Apply contact precautions. B. Initiate droplet precautions immediately. C. Wait for lumbar puncture results. D. Provide prophylaxis to visitors. Answer. B. Initiate droplet precautions immediately. Rationale. Delay increases exposure. Droplet precautions are required until confirmed otherwise. Question 38. Which nurse action requires correction during sterile urinary catheter insertion? A. Keeping sterile field waist high. B. Touching sterile catheter with clean gloves. C. Using sterile drape under patient. D. Maintaining sterile technique until insertion complete. Answer: B. Touching sterile catheter with clean gloves. Rationale: this breaks sterility and increases risk of UTI. Question 39. Which action during patient transfer shows proper infection control for TB? A. Patient wears surgical mask. Staff wear N95. B. Patient wears N95 mask. Staff wear surgical masks. C. Staff wear gloves only. D. Transfer with no PPE if less than 10 minutes. Answer: A. Patient wears surgical mask. Staff wear N95. Rationale: patient source control plus staff airborne protection ensures safety. Question 40. Which patient requires immediate placement in protective isolation? A. WBC 6000 per cube millimeter. B. ANC 80 per cube millimeter. C. Platelets 90,000 per cube millimeter. D. Sodium 138 milliequivalent per liter. Answer: B. ANC 80 per cube millimeter. Rationale: extremely low ANC, less than 100, carries highest infection risk.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.